Everybody,
Good morning, Mr. Jones.
how are we doing today?
Again, all is well.
Yes, all good. Why am I standing like a superhero? Here's the secret desire to be a superhero. You guys doing okay today?
All is well, sir.
Okay. Only 2 more weeks. We're no longer part of each other's lives.
Unless you're my therapist.
Unless I'm your therapist.
So
You know what though? I couldn't be your therapist.
Why? Oh, because I'm not married.
No.
Mr. Mr. Jones.
I couldn't be your therapist because you are my student and I'm your instructor.
Mr. Jones?
To be your therapist, there's something called a dual, let me think, one second. There's something called a dual relationship.
Sorry.
Where it is unethical for a mental health professional to have this type of relationship with a client and this type.
But we won't have this relationship no more.
That is true. That is true. And that's never been a situation, so I don't know. I would have to consult with a call to see if that, because I know we couldn't do it right now for a
Right.
fact, because that will be a dual relationship. Yeah, I know we can do it now. But like if you were a coworker, that we couldn't do it, because that's a dual relationship. You be a coworker. I can't be your coworker and your therapist.
Right, exactly.
But you're right. That's a very good point. I don't know about that. That's good. That's very good. Sharp. Very, very, very clever. Let's see. Well, let's start out with some positivity. Well, since you got the mic, Sydney, something cool happened to you since we were last together? Or something you're grateful for?
I'm grateful to be here. I'm always grateful to wake up in the morning.
That's cool.
That's just good thing I think of.
That's good to know. Very good stuff. Cameron, anything cool happened to you since we were last together? Nothing? How about something you're grateful for?
My family,
Your family? What does your family consist of?
my mom and dad.
Mom and dad together, that's nice. Everybody live in the same house?
Yep.
Okay, that's not everybody's situation. So that's good for you. All right. Well, of course, since we only have 4 more classes left, there's definitely a lot to do. So, I'm gonna make the announcements and we're gonna get right into it. I'm just gonna briefly make the announcements and do the more in-depth announcements in the class for more people who are not here right now. Yes, sir.
How are we going to do another test activity to practice for the final test?
My plan, if we can get enough done, is to do a review activity which will cover the 4 chapters that will make up the final.
Awesome.
That is the plan. That is the plan.
And what's the final test?
December 2nd, which is the Tuesday of finals week. That is when the final is. Right here. Same bad time, same bad time. Yes, James?
Yes.
Oh, he had the same question. Anybody else has any random questions? No? All right, very cool. Let's see. I'm gonna make the other now. I did send an email out yesterday, which I'm gonna go over that in class as well. So today we're just gonna we're gonna finish chapter 12, psychological disorders. We're only really looking at 2 things in depth, and that is, we're gonna start out, we're gonna talk about autism, and we're gonna talk about eating disorders. And we'll pretty much be done. I mean, we'll touch on some disorders that fall under the umbrella of sexual dysfunctions. We'll briefly talk about that. We're not going to spend too much time. And then we're going to start chapter 13. We talk about all these issues and all these challenges and conditions. We got to talk about how to treat them. So the next chapter is chapter 13, treatment of psychological disorders, which we're going to start probably in about 20, 30 minutes. All right, so let's get right to it. This is where we left off. Hopefully everybody still has your notes that I handed out to you, so you wouldn't have to write anything down. But we ended with a discussion about ADHD, talked about 2 different times, 2 different types, attention deficit hyperactivity. Now, let's move over into autism. So, you should already have this. So the top definition of autism spectrum disorder is they're kind of applying it to disorders that impact children. But please do not think that autism is just a condition for children, because that is not. Children may be diagnosed with autism, but there are plenty of adults walking around who are somewhere on the very wide spectrum of what's called autism. Now, this definition, I like a little better, the one that I underlined and the one that is in your notes. It refers to a broad range of conditions. It's a lot of different conditions, characterized by challenges, perhaps with social skills, maybe not, repetitive behaviors, maybe not, speech and nonverbal communication, or maybe not. The autism spectrum is so wide that there are some people who you would have no idea that they're on the spectrum. There are some people who are on the spectrum and they don't even know they're on the spectrum because it's just a small mark. They're on this end of the spectrum. Now, on the other end of the spectrum, they may not even be able to speak. When I worked at a place called Laurel Heights, I mentioned this before, sometimes I worked on the autism unit. Those were young people who were on the spectrum to the point where it was unsafe for them, or it might be unsafe for people, which is why they had to go and stay at a residential treatment facility. If I walked on that unit, I have to be doing this. I gotta get around, because on that unit, I could get punched in the back of my head if I'm not alert. Because that's just the extreme. Yes, sir. I mean, I could get punched in the back of my head. I walked in that unit and been punched in the back before because I wasn't paying attention. Because they're on the far end of the spectrum where they can't even control a lot of their behaviors. And so some of them could be really aggressive. But that's the severity of their condition. Like I said, and there's other people who you can't tell they're autistic at all. They speak, they're smart, they're engaged, they're social, they date, they have a girlfriend, they get married, they have kids, you just don't know. According to the CDC, Centers for Disease Control, autism affects 1 in 36 children and 1 in 45 adults in the United States. And that part at the bottom, I'm gonna read that. Autism looks different for everyone. Each person with autism has a distinct set of strengths as well as challenges. Some autistic people can speak, while others are nonverbal and they are minimally verbally communicate in other ways. Some have intellectual disabilities, and some do not. Some require significant support to make it through their daily lives, while others need less support or no support, and in some cases live entirely independently. For some reason, nearly 4 times, autism is 4 times more common in boys than girls. Everybody knows why, but that's just the way it is. Now, this is on a side note. There's one of my favorite shows on Netflix. I'm not even kidding. It is truly, I get so excited. I hope they're going to be able to do another season. There's a show called Love on the Spectrum. Has anybody seen this show?
No.
Love on the Spectrum. No one's seen it? Have you seen it? Did you like it? This show is literally about adults who are on the spectrum, but just like all of us, looking for love and a good relationship. And so then you follow like maybe 4 or 5 people through the season as they go on blind dates, as they try to meet people. And it is, I don't know what it is about this show that I just love so much. And the people on the show, they're varying levels of autism. Some, you can see, ooh, that's really tough for him. He's really sensitive. And then other people, you feel like, I would have never thought she was autistic. By the way she acts, the way she talks, I would have never thought that. But I think one reason I like it so much is they're so sincere. Like most reality shows, people know the cameras are there, they know they're mic'd up, they're gonna behave a certain way. The people on this show, Love on the Spectrum, they're being authentic, they're being real. And if a girl is on a date and she starts getting anxious, she may tell the person who's doing the camera, you know what, I'm really feeling anxious right now. I can't finish it. I can't do this date. Love this show. You don't understand how much I love this show. Like I remember one time I found out a new season came out. I ran upstairs and told my wife, "Oh my God, Lori, the next season is out." Like, it was just awesome. Anyway, all right. Any questions about autism or the autism spectrum disorder, which is wide? Okay, let's look at some people who you may or may not have heard of who are also on the spectrum. That top guy, in case you don't recognize him, if you have ever been on Facebook, there's your creator, the founder and CEO, Mark Zuckerberg. He's gained worldwide recognition for shaping the way we interact with each other online. 2013, he made a public statement that he has a mild form of autism called Asperger's syndrome, which is now part of the autism spectrum. The term Asperger's, which was usually meant high functioning autism, we don't really use and they don't really use that term anymore. Asperger's, it's just functional. So there's a guy, a multi-millionaire, probably a billionaire, who knows, on the spectrum. The guy underneath him, speaking of wealthy people, you guys recognize him? Anybody drive a Tesla in here? No Tesla owners yet? Okay. Well, that's Elon Musk. Creator of Tesla, the automobile, creator of SpaceX, and some other things as well. He's mentioned being on the spectrum many times, including on Saturday Night Live. He was a host of Saturday Night Live, and during his monologue, he mentioned being on the spectrum. And then finally, the guy at the bottom, you may or may not know who he is, but he's Anthony Hopkins, a very famous Academy Award winner. He was in, what was his big movie? He was a serial killer.
Silence of the Lambs?
Yeah, Silence of the Lambs. That was a huge movie. That really blew him up when he played a serial killer. But he revealed in 2017 that he received a late life diagnosis of Asperger's. That means when he got the diagnosis later in life, he didn't know. I said, some people don't even know. But he felt his obsessive and detailed-orientated nature, he saw it as a gift, and it helped him to be a successful actor. Now, I've had many clients who are on the spectrum, and they've all been different. I mean, some of the teenagers have some similarities, like typically a lot of them, they had a super interest in something. And when I say super interest, I mean when they're not just interested, they know everything about it. I had one, he was really into dinosaurs. He knew the scientific term for every dinosaur you showed him. He's not just gonna say, oh, that's a T-Rex. No, he's gonna give you the full name. And then he got into ships, like old sailing ships, like pirate ships. He could tell you what type of ships those were, when they were created, and when they changed. Like, he just knew everything. So some people on the spectrum, they do have an intense interest in something, but they also have this vast knowledge about it. It's not just an interest, they retain this information. All right, let's move on. Some other disorders you need to know about. Psychoactive substance use disorder. Okay, these are diagnoses. These are just a diagnosis associated with the use of drugs and drug abuse. Alcohol use disorder. Of course, those are diagnoses that are associated with alcohol. And these are symptoms that can really cause some psychological disorders. Okay, but like I said, you don't need to know this for the test, but let's move on to eating disorders. Whew. I used to show this video in class of this woman in Europe who had an eating disorder. The video was just really hard to watch. I'll get into that in a second. All right, so there's three main types. Anorexia nervosa, which they used to say is anorexia, or they say this person's anorexic. There is bulimia nervosa, but they usually just say that person has bulimia or binge eating disorder. None of these are good things here. Now, let's look at the first one, anorexia. A person, usually, but not always, usually an adolescent female. There are plenty of grown adults who have anorexia, and some of them are male. So anorexia is when a person maintains a starvation diet, meaning they don't eat much food, despite already being really, really underweight. Despite being really, really skinny, they're still not eating much. And this is because they have an inaccurate self-perception, which may be accompanied by excessive exercise. So what does this mean? Anorexia means this person may only be eating, I don't know, a spoonful of rice a day. They're really skinny. You can see their bones, their ribs, their hip bones. And they're working out. And they're on the treadmill. But in their minds, that self-perception, they think they need to lose weight. They think they're overweight. They're obsessed with losing weight and obsessed with not gaining weight. Sometimes a person can have anorexia and you may not know it. But then you also too, you don't want to make the assumption just because a person is really thin or skinny, you don't want to make the assumption that they have anorexia because you don't know. Now, the next one, bulimia. A person's binge eating, usually high calorie foods. In other words, they binge eat junk food, usually. And it's followed by inappropriate weight loss promoting behavior, such as vomiting, laxative use, fasting, excessive exercise. So in this condition, a person, they go through periods, maybe in the day where they just they eat a whole bunch of junk food. They may eat a whole cake at one time. They just binge, eat, like I said, it's junk food. And then after they eat all this stuff, they go vomit it up. They may use a laxative to get it out the other end. They also may engage in excessive exercise. A person with bulimia, they're not like a person with anorexia, they're gonna look really good. It's a good chance they look really, really thin. This person could look like anybody. Person with bulimia, you don't know. They could be overweight, but they may not be. A person with bulimia may go out to dinner with a bunch of friends, eat a really hearty meal, and then excuse themselves to go to the bathroom and make themselves vomit. And then you have binge eating disorder, where this person goes through episodes, binge eating episodes. They don't tend to go vomit or take some laxative. But after they binge eat, after they eat all 12 muffins and some potato chips, instead of going to vomit, they just feel bad. They feel guilty. They feel disgusted. I did it again. I'm such a nasty, horrible human being. So they do it, and then they end up beating themselves up. And I would like to say, I hope no one in this room has any of these conditions. I would like to say that no one in this room knows anyone who has any one of these conditions. But the likelihood is, some of you probably do know somebody. Or it's somebody you know and you just are unaware that they have one of these conditions. Now, anybody have any theories of why like anorexia tends to most often affect females, especially adolescent females? Yes. Probably right.
It's, I guess.
What was that?
I mean, I had it, but for me, I don't know if it's for everyone, but it's like mostly like due to the fixation of like, I guess like an unachievable, not an unachievable, but like the fixation like in a certain body type. Well, that was just for me.
No, thank you for sharing and being willing to share that. That's not just you. No, a lot of females, you're right, who are dealing with that. They got this image of trying to match this certain body type. And where those images come from? Well, I mean, if you want to share, where were you getting these images from? What were you?
I guess from like people from school and like that online too. I feel like online was really bad, especially during quarantine. It was just like
Quarantine messed, a lot of people got messed up on one issue or another. Yes, but yeah, your peers can sometimes make a person feel like they need to lose weight. And then you said social media. Social media is huge. Even if you go to the grocery store and they always have magazines somewhere, the women on the cover of those magazines, are they usually, I mean, what do they look like?
they're really skinny. They're not very body
They're
inclusive.
really skinny, exactly. I remember I was looking at some a yoga magazine, I was like, I think I was in Whole Foods. Sometimes they sell this yoga, and I was like, they always put a thin woman on the front. They act like only people who are thin do yoga? What are they saying here with this cover? It was it just dawned on me, I was like, if I didn't know better, I would think they're saying, you can only do yoga if you're thin. I'm just saying, if they've only had thin people on the cover of the magazine. But yeah, it's definitely female. I don't know how, like, adolescent males are more and more concerned than ever about how they look. Definitely, whether it's hair, physique, abs, biceps, and they're comparing themselves to other guys. But women, or adolescent females, probably do a lot more comparison with their friends. I've had some female adolescent clients. It can be rough if their peer group, the girls they hang around with the most, they're considered the pretty group. Now they feel like they have to always be on their level to stay apart. That's the more popular group. So, yeah, it's the images. I said it before. Comparing yourselves to other people, or in the words of the former president, Theodore Roosevelt, comparison is the thief of joy. Compare yourselves to other people, you're just gonna, especially if it's somebody who you don't feel you measure up to. So, all right, any other thoughts about anorexia? Okay, real quick, under the umbrella of sexual disorders, this could be, a person could be diagnosed with a sexual desire disorder, like meaning perhaps they don't have a desire for sex anymore. Or a sexual arousal disorder. Maybe for some reason they're unable, especially with a male, to become aroused in order to engage in intercourse. And then paraphilic disorders, those are really intense sexual urges. It ties in sometimes with fantasies. It can involve things it can involve weird objects, situations, people, things that can really do some harm. Okay, but you don't have to worry about that for the exam either. And that's pretty much it. So, how common are these psychological disorders that we've discussed last week? Well, pretty common. We talked about anxiety, depression, PTSD, schizophrenia, personality disorders. 1 out of 2 people in the U.S., think about it, 1 out of 2 is likely to experience a psychological disorder at some point in time. 1 in 2. Now, it just might be, maybe at some point in our lives, you too may experience depression. It may only be for a couple of weeks. Maybe you lost love. Maybe you might experience anxiety. Or it might be something even more serious. But 1 in 2 people. Mental health difficulties are global. This is not just an American thing. And in developing countries, like second and third world countries, where they have a low standard of living, low poverty, low literacy, low education, low life expectancy, 90% of the people in countries like that, if they have a psychological disorder, they receive no care at all. Think about it. So in other countries that aren't like ours, they got emotional and mental issues, and they're not going to get any treatment for it at all. I mean, a sad example, I don't want to get political, but like the Gaza, there's Palestinian people, that whole little strip of land has been devastated. A lot of kids have been killed, parents, brothers, sisters. None of those people are going to get treatment for that. None of them. I mean, somewhere in that area of the country, in the world, there is probably a 10-year-old who does not have any parents anymore. Maybe saw their brother, sister killed. They're going to be affected with that for the rest of their lives. Never going to see treatment. So, all right. And on that chipper note, we are done with psychological disorders. Now, if we're going to talk about psychological disorders, we need to discuss treatment, because people need help. So let's get into that. Any questions about disorders before we move on? All right, well, let's move on to treatment. All right, this is just a chapter overview. There's different approaches that people have used to try to treat people who have a psychological disorder. Some of those treatments have different goals. We're going to look at how effective therapy is, and then some of the main approaches regarding psychodynamic, behavioral, cognitive. But first, let's talk about the people who provide the treatment. There are 4 different groups of people who provide mental health treatment. First one is, you don't need to know this for the test. First one is a psychologist. These people have a doctorate degree, meaning they got bachelor's, then they got a master's, and then they stay in school to get a doctorate degree, which can take another 5 years. Now, the psychologist is trained to evaluate mental health stuff by doing interviews, they do evaluations, they may do testing, and they make diagnoses. A lot of schools have school psychologists. They're the ones that do the tests and evaluations. They can do therapy. Most psychologists I've known just do testing and they do reports. They do psyche, they call them psyche evals. Now, I'm part of the second group, counselors, clinicians, and therapists. These are people who have master's degrees, and they do it aggressive, and they're trained to evaluate a person's mental health issues using a variety of different techniques. They may be called a counselor, like I said, a therapist, and they're usually based in some sort of treatment center. Clinical social workers are really similar to counselors and clinicians because they can do therapy too, and mental health, and they usually do, but they also get additional training that helps them to be able to deal with case management or other advocacy issues. Like they may have a client who, oh my God, it's a 14-year-old who's pregnant. So yeah, that 14-year-old needs therapy, but that 14-year-old also needs to figure out how to pay for that child's needs. So the social worker may hook them up with somebody where they get free diapers or some clothing or something like that. And then we have psychiatrists who are licensed doctors who specialize in psychiatric training. Like they were in med school and they said, my specialty is gonna be the world of psychiatry. Just like somebody said, I wanna specialize in plastic surgery. Somebody else said, I wanna be specialized in the brain. These people said, I'm a doctor, but I want to specialize in psychiatric training, and they can diagnose. Most psychiatrists, I don't know any psychiatrists that have ever done therapy. They can, I just don't know any that's done therapy. Psychiatrists are people who write your meds, your prescriptions. Oh, you have ADHD? Oh, you have depression? Here, can you write your prescription and start with this dosage? Let's see how this goes, come back. And you come back and discuss, so how does that make you feel? How's it been on this? Do we need to up the dosage? Do we need to reduce it? Oh, do we need to change the man altogether? That's what psychiatrists do. And they get paid, typically, in a typical situation, they get paid more than anybody else because they're doctors. All right, time to write some notes. Let's define the term psychotherapy.
A treatment in which a trained professional, a therapist, uses psychological techniques to help a person overcome psychological difficulties and disorders resolve problems in living, or bring about personal growth.
There you go. That was a long definition. And where are the sign-in sheets? Are they floating around? Should be two. There's one. Pass that one around. And then where's... Okay. There. Did you draw that?
No, it's just.
Oh, I was about to say, that's impressive. You drew that. Anybody over here need to sign? The first part is important. A treatment in which a trained professional, that's important.
Bring about personal growth.
Psychotherapy, a treatment in which a trained professional, typically a therapist, uses psychological techniques to help a person overcome psychological difficulties, psychological disorders, resolve problems in living, or bring about personal growth. Psychotherapy is about basically a professional trying to help people with their issues. That's really, the simplest definition is professional helping somebody with a problem. That's it. That's pretty much what it is. All right? Am I good? As much as therapy can be helpful, there's some people who don't believe in therapy. Well, maybe one of you don't believe in therapy. I know I've had clients too. Well, they might be like, my mom or my dad doesn't believe in therapy or therapists. Some people back in the day, oh my goodness. I'm so glad going to therapy has become more acceptable. Because back in the day, people didn't want to go to therapy. They would say things like, I ain't crazy. Why do you go to therapy? Or you have people who are part of the religious communities who be like, well, if you got a problem, we need to take it to God, take it to the Lord. We need to go see nobody. And some people still feel that way, to be honest. But going to therapy has become far more acceptable than it was 20, 30 years ago. And part of the reason is because it's, I don't know, there's better explanation, there's better marketing, there's better promotion. And there's even people who are known celebrities or athletes who talk about going to therapy now. It's not uncommon that a celebrity says, you know what my therapist told me. I hear it all the time. You guys ever heard of like a famous person talk about going to therapy? They like to hear it all the time. My therapist told me, I learned this when I was talking to my therapist. So it's becoming more acceptable as a result, which is good. All psychological approaches to therapy, they're always trying to help. But what type of help they get depends on the situation and the certain type of therapist that may or may not be appropriate. Now, let me just say this. This is really important to me. This is not in your notes. This is important. I don't know how many of you have been to therapy. I don't know how many of you are gonna go to therapy in the future. But please know that if you go see a therapist and they're not able to help you, or you feel like they're not good at what they do, don't give up on therapy because you encounter a therapist who actually may not be a good fit for you, or may not be a good therapist at all. Is every police officer a good police officer?
No.
Absolutely not. Absolutely. Every doctor is not a good doctor.
No.
Every teacher isn't a good teacher.
No.
Yeah, exactly. So there are people in every profession who are not that good at what they do.
Every firefighter is not a very good firefighter either.
Exactly. Every firefighter is not a good firefighter. Some people do a job just because they want to get paid. They did the training. I'm gonna do this job. I'm not really care.
Not to get paid, but to keep the community safe and to serve the
Hopefully
people.
that's the idea. Every plumber isn't a good plumber. Every electrician isn't a good electrician. So just because you hire one plumber and they screw your pipes up, does that mean I'm never gonna hire a plumber again? But for some reason in the world of mental health, people have maybe not the most effective therapy with a clinician. They go, I tried therapy once, it didn't work for me. Maybe it was just that person. Maybe they were a good therapist, but you two just weren't a good fit. When you try on a pair of shoes and they don't fit, when you're at the store, you try the shoes on and they don't fit, do you buy them anyway? I know some females do, because the shoes are so cute. But typically, you don't buy the shoes that are uncomfortable. You go, no, these don't fit, I'm gonna leave these here, or I'm gonna go find another pair that fit me. It should be the same thing for mental health. So I'm just saying, so if you're considering, whether now or somebody you know, or maybe in the future, just understand that, you know what, I'm gonna give this person a shot, and if for some reason we don't mesh well, I'll just try to make an appointment to see somebody else. Or I try to research that therapist before I go see them. Or I'll ask somebody else, hey, do you know a really cool therapist that I can talk to or go see? Word of mouth, referral. I get a lot of people like, yes, I know so-and-so, they said they saw you and they said you were really helpful for them. Word of mouth is powerful. So, all right. So we're gonna go through these real quickly. These are terms that may look familiar to you because we discussed them earlier on.
Now we need to.
Psychodynamic, behavioral, cognitive, humanistic, and person. And we need to person. There are certain types of. These are types of therapy that some people use to provide treatment. So let's take a look at some of these. First one is psychodynamic therapy. If you recall, this was Sigmund Freud's stuff. And so this therapy, the goal of this therapy is as follows. Seeks to bring unresolved past conflicts and unacceptable impulses from the unconscious to the subconscious. Think about it. Freud was all about what's going on underneath. Remember, he was all about that. He was always, maybe you feel this way because you're attracted to your dad, who's jealous, who's with your mom. And we've always got some underlying issue. So write down psychodynamic therapy. This type of therapy we treat people, very few people use this nowadays. This is some old school.
6-2 brain.
Yeah, I don't know any therapist that uses psychodynamic.
Resolve past conflicts. From the unconscious into the unconscious.
So Freud's concepts, like,
Patient's
like I
ideal.
said, it's about bringing, for him, you give treatment by bringing up issues from the past that may not have been resolved, or part of something, somebody's unconscious. Ooh, what do you dream? Ooh, that probably means this, that means that. Let's treat that. Now, he's also the person that came up with defense mechanisms, which was really cool, like denial, things like that, repression. So those parts were cool, how we use different defense mechanisms to deal with anxiety. So that was cool, but like I said, maybe I know some therapists who use this technique and I don't know about it, but no one's ever told me, use Freud psychodynamic therapy to treat all my clients. Never heard that, ever. All right, let's move on. I'm gonna need that. Yeah, there's a lot of critics about using this type of therapy, to be honest with you. They question the whole orientation question. But let's go to the next one. Behavioral treatment approaches.
Please.
You guys need time to finish it?
Sorry.
Okay.
Make use. The basic.
Now, on the exam, if this pops up, the term is also the depth, kind of will give you the answer. You like behavioral treatment approaches. Just say, it treats what? What is it trying to change? What's the first word? Behavior. Yeah, there you go. Behavioral treatment therapy tries to change behavior. That's the easiest way to remember it. You see an exam, behavioral therapy changes behavior. And there's different ways to change behavior. And the purpose of changing the individual's behavior is so that they can live a better life. They can function in a healthier way. Behavioral treatment approaches make use of the basic principles of learning, such as reinforcement. And when we actually talked about reinforcement, we talked about extinction. So reinforcing the positive behaviors, extinction, getting rid of negative behaviors, to reduce or eliminate maladaptive behaviors. So to reduce or eliminate behaviors that affect a person's daily life. This is based on the belief that this person is doing some abnormal behavior, and we need to get them to learn some normal behavior. It includes classical and operant conditioning treatment, which we talked about. We're just trying to change behavior. So let me think of a situation where we need to change somebody's behavior. Okay. I had this. I was doing in-school therapy in Kennesaw. And this boy used to cause so many problems in his elementary school. Like he got sent to the principal a lot. So I would go to his school, Big Shanty Elementary, and I would see him once a week. A lot of times I would go get him from the principal's office because that's where he was sent to. And the assistant principal was like, I think he was like 10 or 11. She said, he got sent to my office and he just stood in my office and he kept kicking my desk. And I kept telling him to stop and he kept doing it. Okay. So she told me that, of course I got him and he didn't mind meeting with me. But clearly, I needed to do something about that behavior. I need to correct it. So I had to come up with a behavioral treatment approach to get him to stop, one, being defiant, and doing something that he knows is so disruptive. So I decided to do what's called prescribing the symptom. What is that? That's where whatever the issue is, you have them do that issue. You're like, what does that look like? Okay, well, let's say if a parent made, this is cruel, I hope nobody's done this to you, because this is abusive. Let's say your parent caught you smoking a cigarette. And instead of saying, I don't ever want you smoking a cigarette, they go, you know what, guess what? I want you to smoke. As a matter of fact, listen, I want you to smoke a whole pack of cigarettes right now. No, keep smoking. Yeah, I know you're feeling nauseous and queasy. No, keep smoking. Keep smoking. You're prescribing the symptom. The symptom is the smoking, and now you're making them do it, and ultimately, they will probably be disgusted about smoking. Yes, Jackie.
My dad told me about that. He said his mom forced him. His mom called him smoking once, and his mom forced him in the corner. Gave him like packs, not like packs.
Cigarette after cigarette?
Yeah, cigarette. Yeah.
Yeah, she was modifying his behavior. That was her intervention to move toward extinction. Did he give up? Did he stop smoking after that? He did? Oh. There's some parents who do the same thing with alcohol. Oh, so you want to drink now? Okay, well, here you go. Sit down. Here, drink this bottle. Okay, now drink this too. And then they get sick and all throwing up. By the way, this is abusive behavior, just in case you're wondering. This is DFACS reportable. But what I did with my client who was kicking it, I was first of all, I was like, so show me what you were doing in the assistant principal's office. And he was doing it. And I was like, oh, keep doing it. I said, don't stop, keep doing it. I literally, because I know he wanted to do something else, more fun, or play a game, therapeutic game, whatever. I was like, no, why not keep going? Kick it just the way you're doing. Didn't you do it harder than that? I just kept having to keep going. We spent like the whole first half of the session. He didn't do it anymore. Because what that did, that increases his awareness of the idiocy and how this is really purposeless of even doing it. I've had kids who had issues with tantruming. We'd be in the session, I'd be like, let me see what your tantrum look like. Come on, I know you get louder than that. Don't you fall on the floor? Fall on the floor. Kick your legs, wave your arms. Come on, let me see it, let's go. I want to see it just like you do it at home with your mom or in the classroom. Give it to me, come on. Sometimes I have the parent come in and say, is this the same level? Oh, he used to do it worse than that? Come on, your mom says you give more intensity. Give me the intensity. I want to see the full-on tantrum. And see now, because they're doing it and they're not in that emotional state, later on, when they are upset, they're going to be like, tantruming is stupid. I remember doing it in Mr. Frank's office. It didn't really, it felt weird. And so now I am modifying the behavior, doing a behavioral treatment approach. So, I'm not telling you to do any of that with people you know. I'm just saying that's it usually worked. With people with tantrum and my desk kicker, it worked. Okay. You don't need to know what these mean, but I do want you to write these down. These are behavioral approaches that people can use. Token system, contingency contract, observational learning, virtual reality exposure theory. Just write down the heading and those 4 items. I'm gonna tell you what they mean, but you don't need to know what they mean for a test. You don't even need to know. You just need to know that these are behavioral approaches. That's all you need to know. I'll explain what they mean. And let's see, I used the first one, the second one. I definitely use the first 2, especially working with kids to change their behaviors. Does anybody have any virtual reality goggles? 1, 2, 3. Are those pretty cool?
Yeah.
Yeah.
I haven't used them in like 3 years.
You haven't used them in 3 years? Are yours even out of date now? The technology has changed.
They still work, but I don't know. I just got bored of them, I guess.
You got bored with them? Who has a newer pair of virtual reality? Yours are newer?
Yeah, I got mine in June. I got like the Meta Quest 3.
on that.
you.
How are they?
They're pretty good. It
Pretty
took
good?
me like a few days to get adjusted to the sensation of,
Does it feel real?
yeah.
I once had, we were talking about this stuff, and then the last day of class, one of the students brought their goggles in, and to show people, it was kind of weird. It was like, there was a dinosaur who was sleeping, and you could see him breathing. And then all of a sudden, the dinosaur, like this huge dinosaur, it's one of them vegetable-eating dinosaurs, he wakes up, and you see his eyes open, and then he comes walking towards you, and he puts his face in you. People were like, you could see people freaking out. It was so funny. And I looked at it too, I was like, this is weird, this gigantic eye coming closer to your face, it was weird.
There's apparently there's a VR set that if you play it, you're supposed to play a game, but instead of dying in the game, you die in real life.
I'm sorry.
Yeah.
That's, I've never heard of that. That sounds like some horror movie type madness. You die in the VR in real life if you die.
Yeah.
Yeah, it'd be hard to sell a lot of those goggles. Yeah, okay. All right, so what are these approaches? Like I said, you wrote those down. Like I said, you'll need to know what they are. Let me see something. Okay, so the virtual reality, people can use virtual reality goggles to help people deal with the treatment because virtual reality is safe. So say, let's give you an example. If a person is afraid of heights and they put on a virtual reality, they know in their minds they're not really on the rooftop of a building. But they still get the vision, they get to practice managing that fear, that anxiety. They get to practice it in the safe setting of virtual reality goggles. I've never used it there because I don't have any, but it definitely could help somebody who has an issue because it helps to desensitize whatever that fear or anxiety is. Now the token system is really just rewarding behavior. So for example, if we talk about my clients with little kids, with the parent's approval, I may work a deal out with the student, with the client, I may say, okay, tell you what, if for every day, I'm gonna check with your teacher, and for every 5 days, like this is when I was doing school basically. If your teacher gives you a star for every day until I come back, when I come back, I will let you pick one of these rewards. That's really token system, basically rewarding somebody. I've had types of deal where, okay, if you do this, I'll let you pick one of these items off of Amazon and I'll pay for it myself. Like I said, I worked this out with the parent in advance, so it's not like I'm doing this on you. So that's the token system. It's just rewarding for positive desired behavior. A contingency contract is where a therapist and a client make a written agreement. Now, it's not legally binding, but there have been plenty of clients, teenagers, pre-adolescents, where I go, okay, let's do a contract. Some people call it a behavioral contract. And I will write it up and I'll be like, I so-and-so put in the blank space and I agree to not pick on my little sister and clean up my room the rest of the week. And when I do this, I will be giving this reward or whatever. And then I have, like, I'll write it up. Sometimes I'll type it up and print it, in fact, and then print it out. And then I'll have the parent there. I have the parent sign it as a witness. Like, I make it like it's a real legal thing. I witness sign it, the parent sign it, I sign it, and then so it's sometimes just, because it makes a child think, oh wow, I have a contract now. I guess I need to really change my behavior. And then finally, therapists may use observational learning, where you kind of teach people, you model teaching people how to handle this stuff. So with little boys, especially if I work with little boys who are into Star Wars, I actually created a whole Jedi training system. I literally have like some Jedi, I have some lightsabers, and I go, okay, we're gonna do our own Jedi training. And I think one time I did it was a young man who was very impulsive. Somebody used to. And so I showed him a clip of one of the Star Wars movies. I don't remember which one, but it's with Darth Maul. I know everybody knows Darth Maul. Like he looks like a devil. He's fighting these two. He's a bad guy. He's fighting these two Jedi warriors in one of these movies. But at one point, they get separated by this invisible force, electrical force field. This wall that separates the two good guys from the one bad guy. And so gradually, because the wall is on a timer, so eventually it's going to open up, and then it's going to close it. So the two people who are about to fight each other, they know they can't fight until the wall dissipates. And so they sit still. They literally get on the ground and kneel and just wait calmly. And so what I'm showing the student, what I'm showing my client is that it's good to practice. If you want to be a Jedi Knight, you have to know when to remain calm and then when to go into action. When to remain calm and when to go into action. And so then we role model that by, like, I got lightsabers. And so we'll be doing battle in the office and they'll be like, okay, freeze. And then we have to sit and we have to calm ourselves down until it's time to get back into battle. I'm literally doing that in session. That's part of our Jedi training program. I do some other stuff, I show some other videos. Because I'm using observational learning. I'm showing them the video, I'm showing them the scene. I'm showing them the scene on YouTube from the Star Wars movies. I'm showing them the scenes of Jedi's being calm and demonstrating self-control. I'm using observational learning to teach them. I'm gonna need that piece. Okay, let's get into some cognitive treatment approaches. As I mentioned from earlier on in the semester, the word cognitive was gonna come up throughout the entire school year.
We wrote about that, have we?
Of course, you absolutely did.
So-
Absolutely did. And so, because cognitive focuses on how we what? How we what? Think, exactly. Cognitive is how we think. So, in other words, the cognitive treatment approach is going to try to change how a person thinks. And we try to change it from maybe a more harmful way to a more productive or better way. Cognitive treatment approaches. At this point, everybody has signed the attendance sheet, is correct? Okay, good. Now, if one day you are looking for a therapist, you may go online, you may go, there's a magazine called Psychology Today. You may go to Psychology Today, and you can put in where you live, like what city, what state you live in, and it will literally pull up profiles of therapists who have signed up on Psychology Today. You'll see pictures of them. You'll see if they take insurance, what type of insurance. Some of them even have videos telling you more about themselves. This is all on Psychology Today. Now, also in their profile, they will probably tell you what type of techniques or therapeutic approaches they use. So they may say something like cognitive treatment approaches. So what is cognitive treatment approaches? It teaches people to think in a more adaptive or in a more helpful way to cope with life by changing their dysfunctional thoughts about the world and their dysfunctional thoughts about themselves. Now, oftentimes, if you're looking for a therapist, they may say that they do CBT. They're like, what the heck? They'll have a list of things they do when they treat people. Right? I utilize CBT. You're like, what the heck is CBT? CBT is cognitive behavioral approach. So what that means, you're trying to change the way they think while also ultimately changing their behavior. So, then they should on their profile, instead of just saying CBT, they should say cognitive behavioral therapy, but still most people don't know what does cognitive behavioral therapy mean. It means they work on changing your thoughts and also to change your behaviors. That's what that really means. Because a lot of our situations that we're in right now have to do with the way we view them, with the way we think about the situation, the way we think about ourselves. That's a lot of the reason why we struggle. We don't even know this. So, as an example, is how you think. We have two people. Let's say the top and the bottom, who lost their job. The top one, the internal beliefs, I'm worthless, is hopeless, now that I've lost my job, which then will lead to depression. But then the bottom person lost their
Incorporates
job. But their
basic.
beliefs are, you know what, this is my boss. My boss is a jerk. You know what, I deserve something better anyway. And their result is they're not feeling depressed. I've had clients who come to me and they're depressed. I had a client, what was that? Last Thursday, I hadn't seen him in about a month. A man, middle-aged man. He literally was like, I got fired this morning.
Please.
Yeah, no, like, he was caught off guard. But he wasn't depressed about it. Because he was like, I was getting tired of the job anyway. I was really thinking about moving on anyway. I was already starting to look about finding it. I was really starting to think about it. He literally said, last week, I did my annual review, and they have to give you a raise. He said, I met all my goals at the annual review, and then he said they have to give a raise. He said, but they only gave him this year, they only gave him a 1% raise. I don't know if you realize, but 1% raise, I don't care what you make. I don't care if you make $30,000 a year or $300,000. 1% raise. Oh, he wasn't happy. He definitely felt he admitted, he said he felt very disrespected. I mean, a 1% raise really means when you stretch out a 1% raise over 12 months and then take out the taxes, basically, they covered his lunch for one day during the week. That's what his raise was. They paid for his lunch for one day. So I understand why he felt insulted. And then the next week, and he said his company had told them they had no plans to do any layoffs. Think about that. And then a week later, he got laid off. That's, yeah, see, you wonder why people snap, and then, you want to go into an office and go crazy. Just saying, I mean, but that's kind of wrong. I mean, you just said you want to really fire, and then you already slapped him with the 1% increase, and then you fire him. Like literally, the day of his therapy session, he told me he got fired. But like I said, he was not depressed at all, because he was like, you know what? He said, after my review, I got his confirmation. I definitely need to continue looking for other things, and he's thinking about doing his own thing now. And so, yeah, I don't even have to worry about him dealing with depression now. Hopefully, he doesn't have to go too long without needing a job. I mean, I know he does, and they did give him a little package. So that's one reason he's not as stressed. Cognitive therapy works with a lot of different disorders. Some people criticize this approach because it may not always be helpful. And you guys got to really understand all these different ways of treating psychological disorders. There's no one thing that works for everybody all the time. That doesn't exist. It's just not. We're all different people. I've worked with kids who have ADHD. What worked with one boy to help him be more calm when behaving may not work with the next little boy. You just don't know. You just have, as a therapist, try different things and see what works. Let me try this. Let me try that. There's no guarantee. Well, this person is depressed. What worked with this person for depression may not work with this person. So there are no absolutes, and so most therapists, although some therapists just use this one set of treatment, and this is what I use, behavioral therapy to treat my clients. Most therapists use a variety of techniques. Most therapists use whatever they think is going to work, whatever they think is going to help the client. At least that's the way I think it should be. All right, humanistic therapy.
Therapy in which underlying rationale is that people have control of their behavior, can make choices about their lives, essentially responsible for solving their own issues.
Any veterans in here? That's veterans there. Thank you for your service. Anybody else? You got free meal?
I don't know, yeah, or,
Gym, like,
yeah, they're buy one, get X% off, stuff like that.
I mean, not that that's a big deal. It's just should be somewhere you get a free
Can
meal.
make
That's
choices.
Marines, Semper Fi.